Hello, and welcome to what I hope is going to be another riveting webinar from Dreamscape Marketing. Today's topic is effectively leveraging trend prediction technology. So a little bit big data and a little bit AI, but the goal is to learn how big data and AI can assist your decision making. I am Dan Gemp. I'm the CEO of Dreamscape Marketing, and we'll be sharing a bit of proprietary data today, as well as our approach to data analysis and how we process large amounts of publicly available data to fuel our decision making in marketing for our clients. Why am I qualified to even discuss this with you? We're one of the larger digital marketing agencies in addiction treatment as well as elective medical marketing. We are a strategic partner, and so we work with a lot of admissions data. We have internal data on over 150,000 residential admissions for substance use disorder. We've launched over 700 healthcare websites, won a bunch of awards. We're currently managing over 400 digital marketing campaigns, SEO, paid search, that sort of thing, for clients in 39 states. So again, a lot of the data we'll be sharing today is our data combined with public health databases and how that modeling can be used to your advantage. The question we're looking to answer is this: what if there was a crystal ball that showed you all of the local substance use related hospital transports and admissions in the last 24 hours? What if you could see all of the data that was on that patient's medical chart in a secure environment? So thinking this through, right, there is a crystal ball. That's where I'm going with this, of course. But with the United States on track for a record-setting 2021 in terms of overdose deaths, how can a treatment program better leverage this data to actually save lives? How can you become a data-driven organization, better meet the need at hand, right? Run a more efficient business in the process, so less expensive cost per admissions, better fine-tuning on where to place your outreach people, that sort of thing. And ensure the best care connections, right? So are you really the best possible treatment provider for every single person? It's not likely, it's not statistically viable. You most likely have a specialty, or you're subject to seasonality, or even if specific substances change or the demographics in your local market change over time, your business model needs to evolve and maintain those key efficiencies to best serve your patients, right? So let's talk about this crystal ball. Big data is here, okay? The computer processing power is here like you've never seen before. And so this big data technology needs to be put to use. It's already here, but it's most notably been used to help us all navigate this COVID-19 pandemic, right? A little red dot on a map and heat mapping technology for every single case and instance of COVID outbreak, highly centralized through well-funded public health platforms. So the data used to populate maps like Johns Hopkins University and the COVID-19 map that you were all seeing on the news every night, this is actually only generated by a handful of companies and that have both the security levels, the licensure, and the professionalism technology to publish that database, to actually process that much data in real time and feed it back to the public. The primary recipients are usually government agencies, the CDC, NIH. And so in 2021, what's interesting is we finally now have commercial access to this data and the ability to refine that data to meet the needs of addiction treatment programs, okay? So imagine a little red dot on this very same map with population density, household income, types of insurance. I mean, a lot of the data that's extremely useful to you in navigating where to add locations, how to run your business. Imagine if you had a little red dot on the map and you could filter and sort that data using AI and these big data sets to your advantage. So this crystal ball does exist. It's commercially available to you now. We're using it. We're using this crystal ball in our marketing and our targeting. So who's feeding it? Where's the data coming from? It's coming from hospitals, right? Groups that are participating in large nationally funded research studies and such. And it's also coming in real time from medical transport companies. They're required to maintain this data and report on it. So picture a 24-hour delay, right? in your town, and the data is extremely useful. It's a full export of patient data daily. And this is on most counties in the country. About 80% of the counties in the nation are reporting on this data daily. It includes key behavioral health treatment qualifiers. So bear with me on why I believe this is a crystal ball. Insurance coverage, step one, gender, age, whether or not that patient has a co-occurring disorder or a primary mental health diagnosis, right? Um, what substance was in use is in their system at the time of transport, and was it prescribed or illicit? Okay, so is this heroin or is it a prescribed painkiller? Slight difference in the consumer's reaction to medical care. And then what are the pickup and drop off points? Is this a patient being transported from a hospital to an acute facility, another detox center, once they're stabilized? Are they being transported for residential treatment? If so, where to? And is that an opportunity for you, or is that a competitor to you, right? Either way, the data set is extremely useful to fuel your marketing, your outreach, your networking efforts, which hospital groups you need to be involved with, and which groups to compete with. So how can we, right, knowing that this data exists and that the types of fields that are available to us are useful, how can we as substance use treatment programs capitalize on this new access? Okay, so these are key treatment qualifiers, key indicators that are available in real time. The faster that a program can understand their marketplace needs, the better they will do. And the reason I'm saying this is if you are able to pivot to meet a new need or a rapidly growing trend, then you can meet those needs faster. You can be the first adopter, the early adopter, and outmaneuver and outpace your competitors for fewer dollars. It's very tactical, kind of guerrilla mentality. It's very targeted data. The more market share can be captured as a whole. So if you're making your decisions on a general understanding and gut level interpretation of your city or state or the insurances you've historically accepted from those better paying states in the Northeast or whatever that may look like, that's not really running a business. That's not really making your decisions based on data. That's making your decisions based on an emotion. With this data, it delivers speed and accuracy at the same time. You're talking to the ideal patient that's the best fit for your program at the right time. And so you're going to see everything happening faster with a greater degree of accuracy. And it does translate to market share, right? You're not guessing, you're making decisions based on math. And that is something this industry has struggled with. Math is not, everyone's favorite field in the space. So let's talk through it. What's available to you and what do I believe is going to fuel your decision-making process in this crystal ball using your new magic powers granted by big data and AI. And again, this is productized. This is commercially available. I'm talking about a product. Location and patient analysis. So the very basis of where are you and whom do you serve, right? Patient demographics, substance use trends, volume of need. These things likely vary drastically from a market like Los Angeles to a market like Long Beach. And you'll see my little heat map here. But what if you use your data to assist you with a variety of business needs? So your acquisition targeting, right? And I mean the actual purchase. If you're acquiring a treatment center, either in LA or in Long Beach, how do you pick its location? And which of those two markets is better? If you're expanding, is it more ideal to expand from LA into new locations in Long Beach or vice versa? If you're doing a de novo build out, where should it be? Specifically where, what region, what neighborhood? And then let's look at your marketing costs. This is one of the largest costs in addiction treatment, okay? Marketing is expensive with digital advertising on Google Ads. This is one of, if not the most expensive set of keywords in healthcare on Google. So there can be very costly inefficiencies. And if you're looking at very broken down, all of the little minutia data points in a market, you can save tremendous amounts of waste and gain in efficiency of spend. So where a competitor might have to spend 20 grand a month, you might be spending 9 and getting better results and better returns from that. And then your geographic keyword targeting. This is mostly for organic SEO and your website content and your blogging. But should you be talking about a city, a major metropolitan region? It's not just Chicago, it's Chicagoland. But in Los Angeles, it's LA, and there's regions, there's neighborhoods, there's Hollywood, there's Orange County. So what keywords should you be targeting? Is it better to boil that down to neighborhoods in Long Beach, or those regional keywords within the greater Los Angeles region? And then your specific program offerings. This is where a lot of groups just say they build their clinical program first, or they have their model established first, and then they do their market research. I think you'll find that certain regions struggle with different substances. There's stimulants are drastically on the rise since the start of COVID. First-time diagnoses of alcohol dependency are off the charts since the start of COVID. Adoption of MAT and outpatient models that are new or newer entrants into the market. These are all key data points. And you're going to see drastically shifting demographics. I mean, we saw exodus out of major cities, but massive investment into the surrounding suburbs, right? So your millennial populations have repositioned, your hybrid and remote workforce is repositioned, and you can follow that data in real time. You'll actually see the flow of household income and the flow of illicit substances kind of on overlapping maps. So now that you see how this data can be useful to you in choosing your location, where do you put your money? And this is a challenge that most of our clients ask us on day one is, am I in the right place? And if I'm not physically located in the right place, am I marketing in the right place? So your ad dollars can go into a different market. You can be in Long Beach because that was the ideal location for you, but your ideal marketplace might still be Los Angeles. So you'll want to use this technology to evaluate both existing facilities, right? You can look up event records at the county level, right? How many instances of hospital admissions for substance use disorder are there? How does that parlay with mental health admissions? Are people being transported to private treatment centers afterwards? Is it outpatient? Is it inpatient? What does that look like? So conduct your market research using this big data. It's available to you. Find a heat map and it will tell you. We're not guessing. We don't choose what keywords we think people are typing into Google. We know geographically where they're located, and we're looking at the actual keywords they're typing into Google that are actually resulting in admissions, right? That market research is going to change your investment by millions in one direction or another. Look at your competitors using that same litmus test. Is there a saturation in a certain marketplace, or is there more opportunity because your competitors are missing something, right? They went downtown, but you're seeing an increasing trend of suburban, high income, opiate specific, male and female audience. And find your ideal payer mix. Are you only looking for private pay? Because that landscape is changing dramatically over the last few years in addiction treatment. So here's a quick example. Let's say that you're evaluating out of network, in network, Medicaid, you're in San Francisco. That would be appropriate to build a high dollar cash pay center based purely on population density and household income. The heroin to wealth ratio and the methamphetamine to wealth ratio in San Francisco is uniquely high, and you would be able to build a successful cash pay or out of network facility there. But not too far away, if you were to evaluate a business model in Oakland, for example, you're going to be looking at a much, much, much higher volume of Medicaid, and you're going to want to build a model that sustains itself from Medicaid levels of pay, right? So it'll keep you full year round, but much lower margin. You may need to tie in other technologies like telehealth and remote visits. So bear with me on that thought, but using this data, you can do your market research, you can find out what competitors are doing, and you can find your ideal payer mix. Seasonality. I have had a lot of people disagree with me that there is drastic seasonality in addiction treatment. And I always go back to the scoreboard and say, what we've seen for 16 years is minimal admissions around major holidays. That should be obvious to all of you, but you know, on the 4th of July, very few people admit themselves to treatment. But soon after the 4th of July, there's an uptick. Uh, Christmas, Thanksgiving, these major holidays, you will not see many admissions during the holiday itself, but a week or two later, you'll see a lot of family interventions, someone who might have had an embarrassing circumstance or you know, experience some toxic relationships during those holidays. You will see a spike in treatment admissions after the holiday. So that's the obvious seasonality. Here's the less obvious example that data would be required to make decisions from. A major university town. So I used Arizona State as my example. There's nearly 50,000 students, right? A city worth of people in one location on one campus. And the trends change during summer and winter breaks, but do they change in your favor? They might, right? Do the students with the highest percentage likelihood of struggling with substance use disorder, do they go home more or less frequently than students that aren't struggling with addiction, right? Do incidents uptick right after spring break and winter break? Are these things predictable social norms? What ages and demographics change in your summer and winter season? So let's say the students all go home during the summer. There's a, you know, large outpouring of students off campus. And so you're treating the local community during the summer months, not college students, right? You might see a shift in demographics from age 21 female alcohol to age 39 male executive struggling with opiates, right? You might see a large demographic shift. Well, that means play into that seasonality. Don't fight it. Lean into it with your outreach efforts. You need to feature your executive programs during the summer months, the winter months. You need to shift your paid search and your organic SEO marketing strategies during those times to hit those audiences more accurately and not waste dollars on college student keywords when there are no college students present. And you do need to focus on a little bit more retail logic, that concept of back to school. Don't run a sale. It's not a back to school promotion, but it is a shift back to a younger demographic. You can look at the male-female breakdown at the university, and you can look at the insurances that the majority of those students would carry seasonally as well. So the definition of seasonality, right? Having real-time data to confirm who the majority of your patient base really is, that's going to fuel a lot of decision making for you on again, where to place your outreach people, where to be networking, where to put your ad dollars, and how that's going to shift and then shift back depending on the season. Let's talk about market demand and how to measure that using the crystal ball, right? So how is the demand for treatment different from city to city? Baltimore and DC, and we're headquartered right in between Baltimore and DC, so that's my reason for the example today. But where should you open in that, you know, Baltimore DC corridor? How many beds? Is there a need for acute medical detox, or is the stabilization already happening in hospitals and we need way more residential care and more IOP, PHP, right? So to do this, you have to measure incident density. Yes, there is a lot of heroin in Baltimore, right? But that's a pretty large scale generalization. What is the incident density of people seeking treatment, of overdose, of hospital admissions, of medical transport to a treatment center? What are the destination facility volumes, right? So you can look at the end of the journey and see where patients are showing up and where they originated. So you're kind of overlaying an incident density map, right, with a destination facility volume. And now you can measure the marketplace. Now you can see, you know, Washington, D.C. actually doesn't have that many full-time residents. Now the suburbs around D.C., it's a large marketplace, large metro area, but Baltimore has more residents. And so if you look at this, the actual medical data, right, the actual admissions data and the transportation data, you can decide very precisely on where you would be looking to add a system of care or add to a network of care that's opportunistic for you in that marketplace. Here's how it impacts your model itself, right? What do you open? How many beds? Again, we were talking about that. Is it a 100-bed campus? Is it a more conservative bed count, IOP, PHP model? Or is it adopting new technologies, right? MAT and telehealth models that you may be historically an abstinence-based program, you're looking to expand, you're looking to add kind of outpatient satellites to your model. But what makes more sense to develop in any given region? It's going to depend on population density, right? As you get out into the suburbs and rural marketplaces, you're not necessarily going to build your campus there if there's not enough demand. But you're going to see a much higher ratio in those markets per capita of substance use disorder. So the services that you are actually going to market will differ by county, right? Down to the county level. So not even a whole state, not even a major city in that state, but you'll see this concentration of population, wealth, and SUD. And you might determine that putting physical locations in those high density areas makes sense. And then your marketing and your outreach is going to highlight MAT models in the more suburban markets, right? Multi-location. And then in the rural markets, you're going to run primarily digital advertising with very little physical footprint. And you're going to focus on telehealth and aftercare and remote outpatient treatment, right? So realize that this data and this AI, it's not just how the marketplace is impacted and how you're affected. It's what should your business be in the first place, and are you providing the right solutions in the right locations? Are you meeting your market where their demand is? Heat mapping. I am being quite literal. Imagine a map of the United States with a little red dot on it for every incidence of substance use disorder in the country. And you also can overlay that map with all co-occurring and mental health primary diagnoses. So that is powerful data. That will keep you from missing the mark. This is going to assist with identifying problem centers, though. Okay, and this is think a little bit the way law enforcement or like a state healthcare organization would think. They need to prioritize. They have limited resources, and they need to prioritize based on problem centers. And really, this can inform your optimum location selections, right? Not just of your facilities, but of your people, your outreach people, your networking, your ad dollars. So here's an example. There's been a shift in heroin activity as a result of specific MS-13 gang activity migrating from Washington, D.C. down into the Virginia suburbs. Is that an ideal market, right? Because of that one specific supply chain, really, right? Do the Virginia suburbs become a primary marketplace for you to build your treatment center? Well, actually, just outside of DC, sure. But the rest of Virginia is very spread out. It's a populous state, but geographically very spread out. So it may not be a primary market. You may find that that's not, even though it's a prevailing trend and there's opiates spilling out into wealthy suburbs, you think that's an ideal marketplace. It may be more limited than you know, or it may already be served adequately. So let's look at another state, for example. Let's look at Arizona and say that the data shows you 81% of all of the medical admissions and medical transports related to substance use disorder. Let's say that they're all in Phoenix, 81% in Phoenix and only 19% in Tucson. Well, are you going to market statewide? Are you going to put all of your dollars into the entire state, right? 50-50 Tucson and Phoenix? What you're going to find is that with data like this, you'll get your ratios right. You'll get your staffing right. You'll keep your ad dollars from being wasted in huge quantities. And so let's shift into that marketing conversation, right? Again, why am I the one as a marketing guy talking to you about this? This is extremely, extremely useful data in setting your ad budgets in the first place and in making sure that your ads are getting to the right person at their time of need, right? So imagine someone was just medically stabilized at a hospital, discharged, but they're not going home. They're not going back to work. They're going into a treatment program. So data such as hospital discharges is going to inform clinical models, right? It's going to inform your marketing adjustments, where your budget and dollars are going based on the reality of what is happening in your community. Again, you might think that you're best suited to treat alcohol and heroin because those have been prevalent trends for a long time. But we've seen the largest increases, right, during COVID in stimulants, in cocaine and meth. And we've seen supply chain factors. It's been difficult for large-scale criminal organizations to get heroin and fentanyl into the U.S. when borders were shut down and when states were in lockdown. So looking at your total marketing budget and evaluating its allocation, right? I'm mostly talking about organic SEO and pay-per-click, PPC, Google Ads. The data is going to inform how much you spend in total, right? What is the total available market? There's not just a million people in every major city looking for treatment every month, but there is a specific number. And you can figure that out and base your budget on it so that you're not spending more than the market will bear and wasting your money. And then also geographically, where should that money be spent? Which side of town, which region of, the wealth to opiate ratio fits your model, those kind of things. A critical thought, I've said this a few times now, but the placement of your outreach team, right? Your sales professionals that are going to meet with social workers and private care psychiatry groups and hospitals. Well, if you know which hospitals and which marketplace are discharging the most substance use disorder related patient cases, and you have all of the data generally about that city and the people in that community, that's where you should put your outreach people, right? And this could be in other states. You might be located in Florida and most of your patient base is fly-in traffic. That's okay, right? That tends to be more prevalent in southern states with, more tropical climates, right? But Texas, Southern California, Florida, a lot of those marketplaces see patients flying in from due north, right? New England tends to head to Florida. The Midwest tends to head down to Texas. Pacific Northwest tends to head down to Southern California, right? Well, then you should have your outreach team in those northern regions, but where? You might not have any relationship at all with those hospitals, and that's where you need to be building. Precision matters in your marketing. So precise pay-per-click ad targeting down to the neighborhood level, right? So is it all of Hollywood or is it West Hollywood? Is it all of Orange County or is it a specific region of wealth that has a known alcohol problem or whatever that may be, and you're targeting there? So think city versus suburbs, which is the better marketplace? Geofencing, right? Display ads, they're very low converting if you just have a national display ad campaign. But if you geofence a hospital and you have a specific number of cases that you're aware of, a family member may be coming to that hospital where a loved one was just stabilized or just suffered an overdose and survived. So imagine the concerned family member sitting bedside, holding a smartphone, trying to make that decision. If you run display ads that are geofenced around that medical system, around that building even, you might find it's a very cost-effective way of driving several informed consumer decisions where they made the choice, they did their own research, they found your treatment center through your ad, and they've decided when they leave the hospital to admit their loved one to your treatment center, into your care, right? So again, I was talking earlier on about using data and AI to make tactical decisions. This is what I'm talking about, right? Allocating your marketing dollars with great precision. Now, how do you model this? How do I build a use case, whether you're a financial executive, an actual owner of a treatment center, a marketing director, a digital marketing expert? You have a crystal ball and you're trying to answer a question, a specific business case about minimizing your budget, or in this case, answering the question, is opening a treatment center in Ohio viable, right? I think it's a good market. I see very strong employer provided insurance trends and blue collar to alcohol instances, whatever that may look like for you. So let's look at the target market. Let's do some research, right? First, right, there's a few layers to this data and you need to decide how deep you want to go. So general marketplace data. What's the best city? What region should I be looking at? Okay, Cincinnati seems to, on a heat map, the biggest red dot is around Cincinnati. That makes sense to me, right? What's the population breakdown? Well, it's 69% female, 29% male, 2% gender fluid. And again, so is that where you're going to find the strongest LGBT community and that's where you should put all your marketing dollars? Not from this data. Is it a primary opiate marketplace? Well, we see that 20% is alcohol, and that tends to follow national norms. So you have this general marketplace data saying, okay, we're going to be looking at Cincinnati at a primarily female target audience with alcohol as a primary or secondary substance. Okay. Now, if you want to get into the deep dive data, right, your demographics and your specific individualized patient transfer data. So this isn't averages. This is in the last 24 hours, in the last 30 days, or even year over year, right? Who is the fastest growing market segment? Well, in this case, it's women age 27 to 36. Okay. And what is the primary substance in question here? It's opiates. It is specifically prescription opiates. How do we know that? Because we have data from their medical charts that's been aggregated and processed by this big data software. And we know that most of them, a majority, are post C-section prescribed painkiller addictions. Interesting. Because now you know that in your marketing communication, you're talking to a primarily female audience who are all mothers, right? You're going to speak very differently to that group than to blue collar male opiate audience, right? Same substance, different gender, different age groups, and there's a pre-qualifier to have had C-sections. They're most likely currently mothers. So looking at average household income, there's an $83,000 average household income in the region, and Blue Cross in-network insurance coverage is the, not again, not most common coverage, that is the most used policy on actual substance use disorder related hospital admissions, right? Now you're using this information to inform your SEO and PPC marketing and your physical locations and your outreach teams, right? So as you're evaluating expansion or evaluating how you're doing, right? Am I spending money efficiently? I think I'm wasting a lot. How do I refine that into a reasonable number or ratio? These numbers are constantly changing. I've been amazed. I've even seen in our system here a specific drug bust, right? Law enforcement sees a huge fentanyl seizure, and it's enough fentanyl to kill the entire state of Ohio or something dramatic like that. And you'll notice, okay, for the 30 days following that period, there's a 10 to 13% kind of trailing off in fentanyl cases and a 10 to 13% increase in cocaine and meth cases. And so you'll notice that the marketplace shifts, remote work and COVID. There was just a large scale increase with this isolation, large percentages of relapse and recidivism nationwide, a larger than average young professional primary first time diagnosis, right? Both for mental health and substance use disorder, right? A whole lot of first time alcohol abuse. So these numbers are going to change. They're going to follow societal trends. Most of them won't be as dramatic as the impacts that have been experienced, pre, during, and post-COVID. But realize that the data should dictate your decision making, not your gut feeling or your personal knowledge of the marketplace. So how could this data apply to your operation? So I'm on a mission with all of this. I want everyone to have this data. Again, it's viable, it's commercially available. I have seen it lead to much better targeting for our clients and in our own campaigns. So it's not that it's a competitive advantage, it is a decision-making advantage because the data simply wasn't all consolidated before and it wasn't all overlaid with actual admissions of any scale or volume. So to see how big data and this AI processing, and again, this specific software can be effectively applied to your treatment program, to your operations, to your marketing, I do invite you to learn more, to book a demo on the software itself with me or one of our digital strategists. You can go to our website. This is a long URL, but dreamscapemarketing.com/substance use trend prediction technology. I'll say it again, but dreamscapemarketing.com/substance use trend prediction technology. And the goal is to, measure the trends, look at this year over year, month over month progress, and make sure that your clinical and your marketing are speaking to the right audience at the right time for the right budget, and that your support staff and the outreach efforts of your organization are meeting the patient at their place of need, not just being online at their time of need, right? There's a step further that you can all be making. that I think will help to, by providing that better fit model at the right time, at the right place, I think that we can work towards driving more admissions and reducing those overdose stats um, to try to pull them down from all-time highs. So thank you for joining me today. I think you'll be surprised at what you can accomplish with real-time data, with the big data, with this admissions trending information. And please don't hesitate to reach out. I'm always happy to lend my 2 cents without costing you 2 cents. My phone number is 443-535-6997. And my direct email is dgemp@dreamscapemail.com. Thank you so much again for joining us today, and have a great one.